Can you do an upper bleph to remove only a little bit of skin? What about on one eye only? I have one sagging eyelid after Ultherapy, while the other eyelid is retracted. Can you just do one eye? Can you control how much skin is removed? My eyes look crazy after this procedure. They look smaller and sad as well.
Thank you for your question. You submitted a photo showing asymmetry and you want to know if you can have a blepharoplasty on one eye alone and just a little bit. You also mentioned in your question that you had Ultherapy, and you describe a couple of things. One is an asymmetry issue, as well as a statement about your eyes looking sad. So I'm going to give you an idea of how I approach patients like yourself in my practice. I'm a practicing cosmetic oculofacial plastic surgeon in Manhattan and Long Island for over 20 years. And certainly technologies like Ultherapy have come before, such as Thermage and variations like that. And we're seeing a lot of patients who are getting thermal devices, not just Ultherapy, but just thermal devices in general. So, to answer the first part of your question, can you do a blepharoplasty on one side? Well, in most circumstances, what we want to do first is establish stability. It has become very, very common in my practice to see patients who have had some type of thermal device treatment who report that initially they saw some improvement and then there was regression. In other words, the effect and benefit of that treatment that appeared initially to be somewhat effective ended up going backwards. And in numerous cases, people have actually said they were worse off. Now, this is certainly anecdotal. It's one doctor's experience, but people have told me who have had similar devices or devices in the broad category of thermal devices have said that their face initially felt tighter and then they felt like their face was thinner and that they had lost volume. With the brow area, I've had patients who came to me and went elsewhere and had this treatment done, and when they came back, they would tell me that that the treatment worked. And I happened to have taken their pictures before, and I showed them the pictures the day that they came to see me, and they looked exactly the same. So what I think that the bottom line in your situation is that there is a certain amount of variability and unpredictability to the long-term effects of this treatment. So to answer again the first part of the question of can you do a blepharoplasty on one side, of course you can always do a blepharoplasty on one side, but I would suggest you wait and allow months to pass before you make this irreversible decision. When you do a blepharoplasty and you remove skin, for a surgeon it is imperative, especially when you're trying to achieve symmetry, that there be stability. If that brow is moving around, then that's going to make it very difficult to achieve that. So if you were to come to practice like mine, I would probably observe you, maybe see you every 3 to 6 months, and take photos from different angles, and then at maybe up to a year, determine whether or not you'd be a candidate. I'd also like to see pictures of you before you had any thermal treatment. So I would suggest that you discuss this with the doctor who performed this treatment for you. Try to see if there's some resolution that can help you with the symmetry issues, and see what can be done. A lot of times these treatments are done in a way that they'll do one treatment and then they'll have you go home and wait 6 months to get the full results. Again, since I don't offer this treatment, I can't give you a detailed explanation as to what is done and what the logic is, but I can tell you that there is a lot of people who who are not achieving the goals that they had set out to achieve with thermal devices. As a surgeon, I can tell you that there is definitely a limit. I have a radiofrequency device called Pelave, and I use it in very specific and limited applications. But I don't use it to try to do very dramatic lifting or to essentially replace what a surgical procedure does very effectively and predictably. So again, I would suggest that you wait and watch where things settle out, and once there's stability, that's the time to make a determination of what to do. So I hope that was helpful. I wish you the best of luck. Thank you for your question.